Hello, everyone. My name is Dr. Walter Matwichuk, and I'm here with my colleague, Dr. Wendy Dryden. He and I are the founders of the Academy of Rational Emotive Behavior Therapy. We have created a training program, a year-long training program offered to mental health professionals who have an interest in REBT. So today we'll be discussing some of the advantages and distinctive features of REBT in order to make the case that our training will be offering something that other cognitive behavioral training programs won't be. So, Wendy, from your vantage point, why should somebody train in REBT rather than go along with what I would call the generic CBT models?
Thank you, Walter. Well, I think there are a number of distinctive features of REBT that, for me, stand out when you ask that question. First of all, let's give some historical context to your question. Albert Ellis developed REBT in the late 1950s, which makes it the first, what some people call the premier approach to cognitive behavior therapy. REBT is most definitely a CBT approach. If you take the term CBT to be an umbrella term looking at the tradition, but it really focuses on the attitudes that people hold towards adversities that lead to their disturbance. So we take from what Epictetus says in terms of, people disturb themselves not by things but by their views of things. And we say that people disturb themselves about adversities by the rigid and extreme attitudes that they take towards these adversities. So our training really focuses on helping our students, trainees, to really master that specific and distinctive version of the ABCs that is so prominent in the wider CBT literature. Second of all, I think REBT is the only approach that makes a key distinction between what we come to call healthy negative emotions and unhealthy negative emotions, and the behavior and thinking that goes along with that. So that we're not interested in training people to help their clients feel less disturbed. We're interested in helping them to respond healthily to adversity. So the emphasis is on psychological healthy responses rather than less disturbed responses to adversities.
Why don't you touch on why we do that? What is the advantage? Because in the generic cognitive model, you have what's known as the continuity hypothesis, where Beck argued that you dampen down symptomatology on a continuum, and that's what treatment should aim to do, where we're actually looking to help people learn to transform their unhealthy emotions and their unhealthy behaviors into empowering self-helping behaviors. So from your vantage point, why is this a better approach? And why should a mental health practitioner say, oh yeah, that's the kind of training I want?
If you utilize the continuity model, as you call it, and try to dampen down disturbed emotions, what you are in fact doing, even though you may not be realizing it, is encouraging people to place less importance on things that they find really important. So if I say, I mildly want to be approved of by Walter Matuchik and you don't approve of me, then my feelings, my disturbed feelings are going to be low. But if I really insist that you approve of me and you don't, then I'm going to have a strong disturbed reaction. And if I think healthily about that, I'll think, look, it's still really important to me that Walter approves of me. He doesn't have to, but it's really important to me that he does. Then I need a strong emotional response to match the level of that importance. And therefore, that's why we have this.
Why is that important to match the level?
Because otherwise you're encouraging people to make things less important for themselves. I don't think we get anywhere in a long-term way by persuading people to actually reduce the level of importance about things that are really important to them.
Yeah, I agree with you. I think that the healthy negative emotions that we encourage people to adopt, I often call, jet fuel. They're motivational to help us change what we can change, or at least live happy with that which is unchangeable. And we never know whether or not something's changeable until we make a good go at it and stay with that course of action. So these
See,
emotions,
otherwise you're actually saying you're advocating a form of psychological health which is marked by low intensity feeling.
yes, and we're actually encouraging people to have appropriately strong feelings depending upon how strongly they value whatever it is they want to see occur.
Yes, and it's a common reservation that clients have that they kind of think that we're trying to encourage them to think that things don't really matter to them, which is the last thing that we're doing. And incidentally, part of the training is to help trainee practitioners of REBT to respond to these doubts, reservations, and objections that clients have when they meet these concepts which we introduce to them as part of the REBT process.
Well, let me throw out a doubt, reservation, and or objection. So if you receive our training, you're likely to be then certified in an approach to cognitive behavior therapy, which is in a minority status. And so the question becomes, why is that the case? How does the mental health practitioner say, this is a good investment in my professional training, and when I'm done, I'm going to be part of the minority party? How does that make sense to do?
Well, reminds me of when I was at school, we were set a mathematic problem and the teacher asked everybody to give the answer, and 29 out of 30 boys gave one answer and the 30th boy gave another answer, and the 30th boy was right and we were wrong. Just because something is in a minority doesn't mean that you have to give up and throw your hands up. I think we have an opportunity in the founding of our academy to be like George Foreman. When he thought he retired, when everybody thought he retired, he came back and he won the World Heavyweight Championship again. We can encourage people to climb aboard the comeback train. And that's, I think, one of the reasons why we developed this academy, because we were concerned that that there was nobody out there that was really strongly advocating for REBT, and that's what we're doing. That's what
Yeah, but
you've
let's
been
back up
doing
for a
for
minute.
the last 3 years, right?
Yeah, well, all right. So my view is that someone should take advantage of this training because of the product's features and benefits. REBT is, to use your words, a tough-minded approach to life's greatest challenges. And in my view, you can, as I call it, chase inferences, as our cognitive behavioral colleagues often do, whereby they try to take an inference that may be leading to, say, anxiety, and examine its utility. The problem with that is sometimes those inferences that we're chasing down the data to refute end up being valid. So, for example, I fully expect someday to speak to a doctor. Every year I go for a physical, and someday the doctor's going to say, well, there's something wrong here we have to work up. And then they're going to chase down that inference that there might be something. And of course, I could sit there and say, well, this is a false positive. I'm not really have anything. It's just an image on a CAT scan that is a false positive. But what happens when they do a secondary test? They do a biopsy and find out that it's cancer. Now I have to come to grips with the ugly reality, the distasteful reality that there's a fatal process that's started in my body. And so in my view, REBT really prepares us to deal with the most difficult aspects of life and helps us to not feel anxious about the inevitable. I think life is really hard. Inevitably, we all will be rejected. Inevitably, we all will fail. And inevitably, we all will die. And rather than helping people maintaining this illusion that their worst case scenario won't ever come true or might be overstated statistically, what we're really doing is empowering people to be strong. And that's why I like REBT. For
But
other reasons too, but that's one reason.
I think also there are approaches which argue that because it is difficult to help people to change their attitudes, and because sometimes they get caught up with it, um, that becomes a problem in itself. Let's not engage in the process of it, of actually helping them to change their attitudes. And REBT says no, even though it's difficult, we're not shying away from that difficulty, because otherwise, as you say, because what you're really saying is, look, adversities do happen, and let's help people to be as healthily prepared for those adversities when they may happen, and to face those adversities when they do happen, and let's not shy away from the business of helping them to stand back and examine their rigid and extreme attitudes and help them to develop a set of flexible and non-extreme attitudes. Let's not shy away from that process. So we argue that maybe once you've actually developed those flexible and non-extreme attitudes, that's the point where you can stand back and examine inferences. But let's not go down the inference chasing route, as you call it. But also, let's not shy away from the business of examining core unhealthy attitudes and helping people to develop a set of core healthy ones.
And the other concept that's very, very powerful is this concept of unconditional self-acceptance. Rest of the therapies will teach boosting self-esteem in one way or another by emphasizing the positive aspects of a person's trait profile, or will teach radical acceptance, but not have a cogent argument for why one needs or had better at least consider accepting themselves. And so we really have very strong arguments about how it's invalid to rate a person. It's always a subjective position that you're taking, and that it works because we have so much empirical data to show that even the most gifted among us will err. And so we're really empowering people to live with themselves, with their strengths and their weaknesses. And none of the other therapies really harp on unconditional self-acceptance like we do. But once I think a person learns to accept themselves, they're free. So I see REBT as a very freeing therapy. We free people from fearing the worst case scenario. We free people from fearing making embarrassments of themselves or shaming themselves. We help empower them to pursue the goals they want to pursue. So I see REBT as a very liberating therapy, well beyond other therapies in this regard.
And it's also just taking on that notion of unconditional self-acceptance. We also advocate unconditional other acceptance and unconditional life acceptance. And I think, towards the end of his working career and his life, Albert Ellis was really, really advocating that those three forms of acceptance was really, really quite central along with the lines of also encouraging people to develop a flexible and healthy mindset, as you might call it, to actually develop those three forms of acceptance, which you've mentioned. One, the importance of unconditional other acceptance is so important. If you just have to go online and see therapists regard various political figures as evil, not about, disagreeing with what they do, but as evil. And I think that we have a real task on our hands to really advocate for a humanistic position towards humans. And also, as you say, life is hard. Let's not shy away from the idea that let's not offer a Pollyanna-ish view of reality. Let's recognize that the world is a complex mixture of the good, the bad, and the neutral. But let's not shy away from the idea that there are bad things in the world. Let's accept them as a means to dealing healthily with them, rather than by being complacent or being resigned to them. So I think that REBT has a lot to offer people as they not only in the consulting room, but as they manage their lives. And we have a lot to offer, encouraging people to accept uncertainty, which again is one of the things that really crops up very much, not only in the consulting room, but outside it too.
And we actually are teaching people a system of ideas that go well beyond some of the more commonly spoken of ideas. So, for example, I'm always talking to people about taking calculated risks. If you avoid taking calculated risks, you're likely not to enjoy life to the fullest. And I know I've made some calculated risks in my life, most of which have turned out, but not all of them. And I don't regret I haven't taken those risks. So I think that consistent with the positive psychology movement, where people are trying to get more pleasure and meaning out of life, REBT is a system of cognitive behavior therapy that says go beyond emotional disturbance. And here are some ideas that we can help you implement that will actually enable you to make your life richer. And that's important.
Well, we're taking a calculated risk in founding and developing the Academy of REBT. As you said earlier, why get involved in an approach to therapy which has, lost its appeal over the years? Because, we could easily fail, but because we are dedicated to the promotion of this system of psychotherapy, which, as you say, is not only got therapeutic applications, but it's got applications in living one's life. It's got applications to the coaching world. It's got applications all over the place. We're going to do our damnedest to succeed while recognizing that we could fail.
Well, let's also deal with the elephant in the room. I know here in America we are enamored. I use that word all the time when I talk about this aspect of psychotherapy, and we're enamored with randomized controlled clinical trials. And if you look at the other cognitive behavior therapies, the second wave Beckian approach and the third wave DBT and ACT approach, these therapies were cultivated in university settings. And that means that the people who cultivated them did research, because that's what academics do. They do research. Where Albert Ellis, who cultivated his brand of cognitive behavior therapy in the rough and tumble streets of Manhattan, didn't do research on his therapy. Now, some people have after he trained them, but that research basis isn't quite as plentiful as the academically based therapies. That might be seen as a weakness. In my view, it's a strength, because that means that we develop something in the real world that is an all-terrain vehicle that's been tested in the real world in ways that these other therapies haven't.
Yes, but although I'm not I've got a more optimistic viewpoint of the research literature, because I think if you look at some of the articles that were written by Dan David and his team at the University of Babaș in Romania, the evidence is there. And I remember having a conversation with Dan, and I asked him openly, would you say, based on what you know about these matters, would you call REBT an empirically supported psychotherapy? And he said, yes, I would. He recognized, as you say, that there were less studies done, but the studies that have been done do show the effectiveness of REBT, to the extent that the leading world researcher can say REBT is an empirically supported psychotherapy.
Yeah. Well, I have respect for Dan's work, and I'm happy to hear that. But I know that what I saw Albert do, which is work with real patients. And if you look at some of the leading practitioners who present data on their therapies, these people haven't seen patients in 30 years. Yet they're the ones who are telling you how to do therapy, where Albert, at the end of his 60-year-long clinical career, it was estimated to have had 180,000 hours of face-to-face time with clients. And I know that I have see patients all week long And I only seem to be getting better at doing it the more I do it. And I probably only have about 25 or 30,000 hours of face-to-face clinical time. But
Yeah.
when people tell you how to do something and don't do it themselves, you have to ask yourself, what does that say? What does that mean?
No, I quite agree with you, I've never worked full time as a psychotherapist, but I've always maintained over my 50 years in the field an active practice, and so the point for our discussion is that the people who come onto our training program are assured that both of us will still be active as psychotherapists and therefore will be drawing upon our current practice rather than practice that we had 30 years ago. And I think that's really important. There have been people in the REBT field who have continued to train, having retired from clinical work, but let people be assured that we don't intend to do this. We're going to be active as our academy goes forward.
Yeah, and the other thing I think that REBT is really strong in is helping people cultivate self-discipline. So when I look at my caseload, I listen to people complain about people. That's a big common problem. So they have emotional disturbance associated with their relationships. But some of the time, people have problems controlling their own urges and avoid self-actualization because they can't discipline themselves. And so I know, Wendy, you're a very disciplined individual, and I would like to think that I am too. And I believe it's because we practice some of the concepts that we're actually going to be teaching therapists to teach their clients. So
I think that's a very important point that you've made there, Walter. I think any of our students who come onto our program are entitled to ask us, how do you implement these principles in your own life? And, and I think we can both point to important ways that we've done that over the years and continue to do that. And so often people practice one's psychotherapy, but then when they seek therapeutic help themselves, they go and seek help from a different type of psychotherapy, which I've never really understood. So,
me too.
so I think that sort of, that it's important for people to realize that we're not only dedicated to the ideas as ideas and the ones that you can actually implement in your consulting room, but these are ideas that can help to make your own life as a person more effective and happier as well. But yes.
And the other thing is I haven't burnt out seeing patients, and I see a lot of them. I might see 35 a week. Why is that? Because I practice REBT vis-a-vis the patient. And I think practitioners who are going to be solid practitioners need to be able to care for themselves and not have to retreat into other endeavors because they can stand the heat. In other words, they have to get out of the kitchen, so to speak. Whereas I know that when a patient isn't responding, I'm not going to disturb myself about that. And I'll continue to work at trying to inspire them to implement these ideas. And also, I don't get stressed when my patients are distressed. And so it's really important, I think, for the psychotherapist to see that REBT can be a way of maintaining your enthusiasm for working with people rather than burning out when you see a lot of people.
Kind of brings us to the end of a very fruitful and interesting discussion. I hope that our viewers and listeners are inspired by what we've talked about and see fit to sign up for our year-long training program.
Yes, and I think that also we're going to continue to offer master classes for the public because the nice thing about REBT is that we don't need this esoteric language that is only spoken by the clinician. Most people, whether they're professionals or not, understand what we're talking about. There isn't this highly technical jargon that needs to be translated to the layperson. So our academy Academy is going to be offering master classes to the public because REBT really is a sensible system of ideas put forth in plain English rather than with highfalutin words. It's really quite a system. So I hope that people will give careful thought to enrolling in our training programs and our master classes. And I know that we're going to give it our best effort. So Wendy, thank you for sitting down with me today and talking about the Academy. And I hope to do it again with you on some other topic in the near future.
Looking forward to that.